Thank you so much, Dr. Tsai and Dr. Ye, for those insights. They are wonderful. And Dr. Tsai also mentioned he's not working in academia anymore. But as I mentioned, he's the economist at the Center of Medicare and Medicaid Services. So we have some audience who are not in the US. So I just want to give you a little bit of background about Medicare and Medicaid. So Medicare is a federal program that provides healthcare coverage for elderly population who are more than 65 years old. And Medicaid is a state and federal joint program that provide health coverage for those who have very low income. So Dr. Tsai, actually I have a question to you, especially focused on the Medicare and Medicaid. So I have been seeing like several discussions, or actually lots of discussions regarding Medicare and Medicaid and how these two federal and state program could support people during the pandemic. And you also mentioned like in your set, researchers also doing research to understand the need from the patient. So I wonder, through the current research, and do you see like any changes or potential changes could be due for Medicaid and Medicare regarding COVID-19?
Well, I think one of the biggest change during the pandemic is the waiver of telehealth, the waiver of numerous restrictions on telehealth, and they did a lot of work to allow Medicare and Medicaid beneficiaries to have easier access to the doctors through either real-time or asynchronous interactions with their physicians. So that creates a lot of new ways for patients to still maintain their some degree of access to the healthcare system. So that's why I was saying that that might offset or moderate the negative impact of the drop of in-person care. I think recently the Congress has been talking about making some of the temporary changes regarding telehealth permanent. So for example, they will relax the restrictions of the originating site. For example, they now, I think in the congressional proposal, they now allow people to see their physicians from their own home, which was previously prohibited. And they will also allow telehealth to be conducted not just by physicians, but also by physician assistant, licensed nurses under maybe not direct supervision of the physicians, but under general supervision. And some other restrictions could be relaxed as well. But one thing that seems to haven't been really discussed is the pay parity. During the pandemic, Medicare pays the telehealth visit the same rate as the in-person visit. So the latest congressional proposal hasn't really mentioned whether pay parity will be maintained, because Congressional Budget Office, which is the official government agency, congressional agency to score all congressional proposals, still maintains that in a general situation, telehealth still will increase government deficit, because a lot of times telehealth were being used not as a substitute to in-person visits, but to be used as an addition to in-person visits. So unless their position changes, it's very difficult for Congress to pass any laws to relax the restriction, to remove the restrictions of telehealth significantly. So I think that is still an ongoing issue, and there's still a lot of debate on both sides. And I think we will just wait and see how it turns out.
Right. I think telehealth, there's a parallel development in China as well. You see, COVID-19 is interesting. Also, of course, it's causing great damages. But on the other hand, it is also pushing forward some of the things that are already happening on the peripheral to the core. And I think telemedicine is one of them. And similarly, I mean, in China, during the outbreak, many of those visits are free, and now the government is actually issuing policies to formulate, make it formalized that social health insurance might consider actually covering telemedicine. I see one of the question in the chat box is about telemedicine in the US. I think that telemedicine is providing great convenience. There's no question about that. But for the next step, it does require more study and regulation on standards of care, and also referral pattern between online, offline, whether there is tied financial interests. All of those need to be understood better.
Right. And also, one critical difference between U.S. and China is that the U.S. allows telehealth to be used as a means for initial visits,
Right.
but China only allows for telehealth as a means for return for follow-up visits.
That's right.
And so that's one critical difference. And I agree that there's a lot of technical and policy things to be considered, and especially the prospect of greater fraud to be conducted in telehealth. And I think that's a common problem for both China and the U.S. It's a huge challenge how to combat, abuse and fraud of telehealth.